I always ask my guests to tell me, if you had to highlight one surgery that separates you from your peers, what would it be and why?
Good question. There's actually a few different things that I like to do that you can arguably call surgery, but I prefer to call them procedures. So between conservative treatment and surgery, there are at least three different things that I like to do to consider getting a patient to at least get some relief. One of them is shockwave therapy, one of them is platelet-rich plasma injections, and the other one is a minimally invasive procedure called Tenex, which is almost the closest thing you're going to get to a magic wand.
Really?
It's a tiny little incision. And basically,
is this done in an office?
This is done typically, I prefer to do it in an OR setting, an operating room setting.
Okay.
Just to be clean. But it's another way of describing it, arguably, is a glorified injection, because the incision is so small that in most cases it doesn't require a stitch.
Oh, wow.
And so the idea is to pulverize and get rid of inflammatory tissue, which hopefully get you back on your feet a lot quicker. But something that I really enjoy doing, not necessarily in the sense of doing the actual surgery itself, which is not too involved, but in terms of patient satisfaction, is ligament reconstruction for ankle sprains. I'm not sure if you know this, but one of the most common reasons why individuals end up in an emergency room is because of an ankle sprain. And very often it's just referred to as just an ankle sprain. Very common terminology used by nurses, doctors, and patients alike in this, and I genuinely feel it's the wrong terminology, because there's actually three grades. There's grade 1, 2, and 3. Grade 1 meaning your generic ankle sprain that everyone typically has had, right?
Yeah.
Especially if you play sports.
Yeah.
Your grade 2 is when you have a partial tear of that ligament, and a 3 is when there's a complete rupture. But in reality, because ligament tears are not seen on an X-ray, it's referred to as just an ankle sprain. And what that basically leads to, especially if it's a grade 2 or grade 3 ankle sprain, is that that patient is more predisposed to getting further ankle sprains as the months and years go by. And each ankle sprain makes an ankle even weaker inherently. So if that's diagnosed early enough, my take-home message to certain individuals based on their lifestyle is to strongly consider strengthening it with appropriate physical therapy and bracing.